Did you have a dental implant or undergo orthognathic surgery, and right after the procedure your lips started burning, stinging, and tingling, and nothing brings you relief? Then this video is for you. Many patients come to my office saying they developed trigeminal neuralgia after a dental procedure. That's very wrong. And do you know why? Because trigeminal neuralgia is caused by compression of the trigeminal nerve inside the head. On the other hand, injury to the alveolar nerve, which happens during a dental procedure, occurs exclusively because the nerve was damaged, and that's when your symptoms begin. The treatment is completely different. If your case started after the placement of an implant, the first step is to remove that implant, because the nerve is probably being compressed by it. But if your symptoms began after orthognathic surgery, then the treatment is a bit more complicated. In this case, the most important thing is to start with the diagnosis, which is the topic of this video. How would that be done? First of all, did your symptoms start after a dental procedure? Is the location of the pain, tingling, shock, or burning, the chin and lip on one side or the other? Well then, we already have a diagnosis. Your injury is to the alveolar nerve. You didn't have this before the procedure, and you developed it after the procedure. Now, determining whether it's a serious injury or not is very difficult. Usually, time is what will tell us. We start treatment with medications for neuropathic pain, such as gabapentin, pregabalin, and amitriptyline. In addition, laser therapy can also help, and time will be very important. For example, if you have an intense pain crisis at the beginning, and your pain levels are 8, 9, or 10 in the first few days, but by the third month it's much lower, it was probably a milder injury. However, if your pain remains very intense even after several months, your injury was more severe, and you probably need a more effective treatment. The tests we order for diagnosis don't always make the diagnosis easier. For example, the cone beam CT scan is a type of tomography that produces thin slices of the jaw and shows the space where the alveolar nerve passes, but it does not provide a diagnosis as to whether the nerve was cut or not. The diagnosis is usually clinical. So, if you're dealing with an alveolar nerve injury and have noticed that there's little information about this topic on the internet, please help me produce more content about it by liking this video and following our channel.